It's important that we can use as many tools as we have at our disposal against Aedes aegypti, the mosquito that carries dengue, chikungunya, and Zika virus. We have a public health threat in our region with Zika virus spreading throughout the region. We also now have 2 cases officially recorded in Cayman. So it's important that we go ahead with this project as part of our program to control Aedes aegypti in an effort to reduce the risk of local transmission of the disease and prevent an outbreak of Zika virus in the Cayman Islands.
We received the eggs from UK, they're shipped directly from UK, and then we hatch them here, and it takes about 8 days for the larvae to grow into a full pupae, and that's when we can sort the pupae and prepare them for release.
This technique is not responsive in the way that you would use insecticides, for example, in responding to a situation. It's preemptive, it's precautionary, it's not a quick fix. It does take some time to work, but it's a preventative approach to reduce the population of Aedes aegypti and thereby by reducing the population down to low levels, thereby reducing the risk of transmission of disease. So it's preventative rather than, it's proactive rather than responsive, yes. The technique has been thoroughly investigated and studied for quite some considerable time now, and by several different independent groups around the world. One group in particular who made a recommendation to the World Health Organization that this technique be implemented against Aedes aegypti. And the World Health Organization, based on that study, they made their recommendation, in fact, that this technique be used in an operational fashion with evaluation to see how the project works. And that's exactly what we have planned.
So today we are separating the male pupae from the female pupae. We've been rearing those mosquitoes for about a week, and today they are pupating, and we're gonna do all the processes necessary to separate the males from the females. So in those trays we can see pupae and larvae that they've all been put together from different trays and are now being ready to be separated between larvae and pupae and between pupae, male pupae and female pupae. That process will occur in the coming hours, and then we'll be ready to have a whole bunch of male pupae to be released in West Bay next week.
All of the studies to date have shown that the technique is perfectly safe, and in fact it is designed to protect people. It's a public health imperative that we use this technique, and it is safe for public health and safe for the population in which it's being used. The project is planned to last 9 months following all the community engagement that we have conducted to date. So the actual releases will last for a period of 9 months. They may not notice a great deal of difference, certainly not initially. It will take some time to work. What people probably notice more than anything is the nuisance mosquitoes coming from the swamp and pasture lands and septic tanks and cisterns and all the rest. So they may not notice a difference in mosquito numbers, but that's because we're only targeting one species of mosquito, the Aedes aegypti.
It makes me feel great working with this project because I'm a part of this team that is doing good for the world right now for the Cayman Islands, trying to limit the Aedes aegypti mosquito, and that limits the spread of the Zika, dengue, and chikungunya. So I feel amazing working with this company. I don't think there's any reason people should fear it. I work directly with it. I see what is going on. I test it myself because I'm doing it. I feel that there should be no worries at all about this project.
Once the males are released in the field, they usually leave about 1 to 2 days, and that's enough time for them to find females and mate with them. They can mate several times, so they mate as many times as they can and with as many females as they can find. The offspring of the females that are mated with the friendly Aedes aegypti develops into larvae and late larval stage, even pupae, but then dies before emerging into the adult form that we all fear.
There are many differences between Aedes aegypti and most of the other mosquitoes. The main one being that Aedes aegypti is only active during daylight hours. Most mosquitoes are active after sunset, as people probably appreciate and already know. That's one of the differences. Another difference is that Aedes aegypti only breeds around human habitation. So it only breeds around people's houses and yards. And it only feeds on humans. It only takes blood from humans, again, unlike other mosquitoes.
Residents in West Bay should not be able to notice the difference in the mosquito population. And the reason why is that because we're releasing the mosquitoes in the middle of the road, so they're going to disperse very quickly and go look for the females right away. It is possible that some mosquitoes go directly to one house for weather condition reasons. In that case, don't hesitate to spray them. They are the same as wild mosquitoes, so if you need to spray them, you can spray them.
Like all mosquitoes, it's only the female mosquito which bites. They take blood in order to produce eggs, so the male mosquitoes don't need blood. They can't actually bite. They don't have the mouth parts to bite. They can't take blood because they don't need to take blood. Well, the problem with Zika is it's spreading throughout the region at the moment, and we are surrounded by countries and jurisdictions with Zika outbreaks at the moment. And also the time of year is in favor of the mosquito as we go into the rainy season. So that's another reason that we get moving with this project. This could prove to be a very, very valuable tool in our arsenal against the Aedes aegypti. Very promising results to date here in Cayman and elsewhere in the world. And I think it's important now that we see Zika. We're now into the rainy season as well, when we expect to see an increase in the wild population of Aedes aegypti. So I think it is important from a public health perspective that we get the program rolled out as soon as possible.